Now that you've had a chance to review the patient cases, and now I'm going to review the answers and walk you through some of the key points with them. So looking at case 1, you are caring for Isabella, a 4-day-old term baby in the NICU, who was admitted on day of life 0 for monitoring of withdrawal. The patient's mom was on methadone for the entire pregnancy. Isabella's modified Finnegan scores had been very low, 0 to 2 since birth. She's currently not receiving any medications. The nurse notes this morning that Isabella seems to be exhibiting a lot of withdrawal symptoms, which is a change for her, and wants to know if some medication can be initiated. These are the following symptoms the nurse has noted the 2 times she has used the scoring tool this morning. High-pitched crying continuously for the last 10 minutes. She is inconsolable, has twitching, jerking of the limbs, sweating, temperature of 39 degrees Celsius, has excessive sucking, projectile vomiting, and watery stools. So looking at all that information, what could be the reason why Isabella is all of a sudden exhibiting withdrawal symptoms per the nurse's report? So one of the things you have to think about is, was this patient at risk for withdrawal in general? And the answer would definitely be yes, since her mom was on methadone for the course of the pregnancy. But the other thing you have to think about is at first, Isabella wasn't experiencing any withdrawal symptoms, but now all of a sudden, it appears that she is. So why the sudden change? So you have to think back to the half-life of the medications. So at first, when Isabella was born, the methadone was still in her system. But now, since it's gone on a couple days, the medication may not be in her system now, or maybe not as much. And so that could be why she all of a sudden is experiencing or demonstrating signs of withdrawal. And so the long half-life of methadone has a very variable half-life from anything from 40 to 62 hours. And so that was likely still in her system previously, like I mentioned. So when you use the modified Finnegan scoring tool, so you can use that link from the calculator. What score do you calculate? So I'll say her score is definitely high. There are a lot of symptoms that she all of a sudden was exhibiting that you can plug into that calculator. And so when you do that, her score ends up being 16. So based off of that score, do you think Isabella is experiencing withdrawal? So if you remember the cutoff being basically greater than or equal to 8, so she definitely is experiencing withdrawal. That's a lot higher than 8. So yes, she is. So then you have to think, would this be classified as NAS or NOWS or IOAS? And so thinking to her opioid exposure, where did it come from? It was from mom. So it was when Isabella was in utero. Before she was born, she was exposed to it. So it would definitely be your neonatal subtype. So the neonatal abstinence syndrome or the neonatal opioid withdrawal syndrome. So it would definitely be your NAS, not IOAS. And so based off the score, should pharmacologic treatment be initiated? And so even though 8 is considered the score indicative of withdrawal, what the recommendations are for treatment is really you should have 2 consecutive scores actually greater than or equal to 12. And there was information in the scoring calculator that provided this information, then you should treat it. So assuming this score was what she had the last 2 times, and based off the case it said the last 2 times she scored, these were the symptoms noted. So it seems pretty consistent and consistently elevated. So yes, some kind of treatment should be initiated at this point. So now looking at the second case, so you are caring for Alex. He was a 3-year-old male who has been in the PICU for several weeks. He was initially admitted due to respiratory failure and has been intubated and mechanically ventilated. In order to keep him comfortable while intubated, he was started on a fentanyl continuous infusion. He has been on the continuous infusion for 14 days, and the team started just lowering the dose of the fentanyl in hopes of discontinuing the infusion soon. Based on this information, the attending asks you if Alex is at risk for withdrawal. How do you respond? So thinking back to what are some risk factors for withdrawal, what could potentially cause it? We don't necessarily know the dose of exposure of the fentanyl, but we do know the duration. And if you think back to that study I cited in a previous recording, there was a cutoff of 9 days where greater than or equal to 9 days was 100% indicative of withdrawal. And so the fact we have been on this for 2 weeks, yes, absolutely, this patient is at risk for withdrawal. And so thinking what type of withdrawal, and I kind of mentioned this already, so we've been on that fentanyl continuous infusion. So this wouldn't be NAS because it wasn't neonatal exposure, essentially, or in utero exposure. It was more the patient has been in the PICU and we gave this patient the medication. And so this would be IOAS, or iatrogenic opioid abstinence syndrome. So now we have some scores available. So the team started determining WAT1 scores for Alex when they began weaning the fentanyl. And the WAT1 scores had initially been 1 to 2, but the nurse is concerned Alex may now be showing signs of withdrawal. So these are the abnormal symptoms and results from the last WAT1 performed. So loose stools, vomiting, temperature of 38.1 degrees Celsius, appears awake and distressed, sweating, easily startled to touch, and took 10 minutes to become calm. So looking at these specific symptoms that are noted, you can plug them into the WAT1 specific calculator. Once that's done, what score do you calculate? And so there are a lot of criteria here. So the score is actually an 8 here for Alex. So based off of that score, do you think Alex is experiencing withdrawal? And the answer is definitely yes. So just like our other case example, the score is definitely elevated. So greater than or equal to 3 for the WAT1. So a score of 8 would definitely be indicative of withdrawal. And so you can see a lot of those pictures listed are some of the clear signs that you see, like sweating, your loose stools, vomiting, and that kind of thing. So based off of that score that we had of an 8, should you add an agent to help facilitate weaning of the fentanyl infusion and manage withdrawal? When you think about this, you think the patient was on fentanyl for 14 days, so for an extended period of time, and they started weaning it, but we're still on it, and now our scores are still elevated. So we're not going to be able to wean the drip without some kind of intervention at this point, with our scores already being that high. So it's the idea that let's add on another medication to help facilitate the weaning of the drip. Once we're off the drip, then we can start weaning that other medication. So absolutely, I would add something else on board. And so an example could be adding on a long-acting opioid like methadone. So we can add that methadone on board, be able to wean, taper off that drip. Once we're able to stop the drip, still monitor the WAT1 scores. If they're okay, then we can start weaning the methadone until it's off. And so that would be how you could approach that case. But thank you very much for listening to both of these. Please feel free to reach out to me if you have any specific questions about any of the information I've discussed in any of the recordings. But thank you very much.